Uh, in previous classes, we have discussed about what is a muscle structure and how the basic muscle functions are happening, and how the muscle firing is happening, and how the muscle contractions are happening, and what are the types of muscle contractions, and what are the types of muscle fibers which we can found in human body. So today we are going to discuss about how the injury or any kind of immobilizations or any kind of physiological developments in human body like aging or some disease progression might affect this normal muscular functions. So we will be discussing about how immobilization is going to affect or deform this normal muscular structure, and how the injuries, both the muscular and other injuries, are causing some physiological or some structural changes in muscle, and how normal aging or normal human body development causing changes in human muscular structure. So first we are going to discuss about how immobilization are causing some problem. So basically immobilization means that we are not moving our body parts, we are keeping it in a stabilized manner in order to maybe to recover from some injuries, something like fractures, or we will be immobilizing our body structures in order to get healed from some injuries and all those kind of things. So basically immobilization is the one which is done for any fracture cases. So whenever we immobilize that particular region, for example, if I had some fracture in my elbow joint, I will be keeping my elbow joint in a POP, a plaster of Paris cast, for up to almost about 4 to 6 weeks. So the primary aim of this immobilization is to provide a better environment for this healing process of bone, and I'm also trying to minimize this unnatural healing of my bone. That's the reason why I'm keeping my bone in a particular stable or stabilized manner to give a better uh, healing for that particular fracture. But one of the drawbacks which can occur from this immobilization, which is followed by any fracture or any other kind of thing, is that it may give us some physiological changes in our muscular structure. So our muscles has a normal length, and the muscles normal length is maintained by regular movements or by keeping our body parts in its normal position or in a normal length. So whenever we reduce that particular length, or whenever we try to avoid such kind of movement to our joint, we may inducing some physiological changes in normal muscle structure. So whenever we think about this immobilization, which is done by this POP or by any other external barriers, there can be two situations we can go for this immobilization. First one is, we'll keep our arm or we'll keep our particular limb in a shortened position. That means the muscles will be in a shortened position, and there also one more chance in which we can keep our muscles in a lengthened situation or in a lengthened state to get that immobilization. So whenever we shorten that particular muscle to provide some to attain that particular immobilization, there are some problems which can arise from this shortened position. So the first thing is that it may decrease the number of sarcomere in our muscle structure. So when we discussed about the basic structure of muscle, there is something called as sarcomere. So whenever we keep our arm, or whenever we keep that particular muscle in this shortened position, then the sarcomere may reduce in numbers, because whenever we keep it in a smaller, whenever keep these muscle fibers in a shortened position, the sarcomeres may overlap, and after the, or unfortunately, the number of sarcomeres may come down, and the perimysium, the covering, uh, increase the amount of perimysium, and thickening of endomysium can happen, and collagen fiber orientation become more circumferential, and basically there can be loss of weight and muscular atrophy. So muscle atrophy means the muscles will be going for physiological decondition. So atrophy is a word which can explain as a normal degradation of muscle fibers. So that's what called as atrophy. So if we keep the uh, muscle in a shortened position for a long period of time, then there can be some physiological atrophy or muscle atrophy may happen, and it can also accompanied by some weight loss because we are losing the normal muscular structure. So there will be a loss of weight and it will be associated with muscular atrophy. So these are the things which can happen in a shortened position. So this is how, so if you take an example, so this is our biceps muscle. So the biceps will be elongated in complete elbow extension. But whenever we have an elbow fracture, we keep our elbow mostly in a mid-range position to avoid any muscular not sorry, in any bony dislocations. So whenever we keep our elbow in a mid-flexed position, then what happens? The biceps not in a fully extended or fully lengthened position. It is in a shortened position. So whenever the muscle is in a shortened position, it can be accompanied by all of these physiological deconditioning. All of this physiological condition can happen accompanied with this shortened muscle shortening, which is done by immobilization. So this is an classical example. We can define how this immobilization can reduce the muscle length and how it can affect the muscle structure. The loss of sarcomeres displays the length and relationship of muscle so that the maximum tensions are generated correspond to immobilized position. So whenever we alternate the length of that particular muscle, then that length tension relationship can also varies. So when we discussed about this extremes of range which can produce less amount of tension, in when we discussed about length and relationship, we told that whenever we go for extremes of joint range of motion, then there can be a reduction in muscular tension. That particular situation may get adapted to this new length which can cause by this shortening of muscle. So that's what happened in length and relationship. The muscle that has adapted to its shortened state will resist lengthening passively, thus limiting range of motion. So whenever we keep our elbow joint in this particular position for a long period of time, that means if we keep it for a more than 2 months or something, then the muscles and all the structures which are surrounding this elbow joint may adapt to its new normal length. So whenever it adapted to that new normal length, then uh, achieving that full elbow extension may not be occurring, or it may be hugely painful, and it can be excruciating in terms of pain and all other difficulties. So whenever this prolonged shortening happens, then there can be reduction of joint range of motion mainly caused by this adaptation of new length, and the overall tension generating capacity of the muscle is decreased, and the increase in connective tissue in relation to muscle fiber tissue results in an increase in stiffness to passive stretch. So whenever we try to provide stretching to maintain that length or to achieve that normal length, it may be, it may not be possible just because of this changes in tension generating capacity. And next scenario is that we can keep our immobilization in a lengthened muscular state. That means we can go for immobilization, but the muscles will be in a lengthened position. For example, if you had some lower limb fractures or if you had some femur fractures, then there is no need of getting this shortened muscular immobilization, but we can actually go for a lengthened one because we will be keeping our elbow joint, knee joint in a fully extended position to minimize this effect. So when we compare this lengthened position with shortened position, the lengthened position is much more advantageous when compared with lesser or the shortened position. The primary structural changes are in are an increase in the number of sarcomeres, resulting in a decreased sarcomere length at the lengthened position. increased endomysial and perimysial connective tissue, and muscular hypertrophy may be followed by atrophy. So as I said, in shortened position, in this also there can be some amount of atrophy can happen, but followed to that atrophy there can be a hypertrophy. So it just means hypertrophy means increase in normal size of the particular structure. So in this the hypertrophy can followed by a followed by an initial atrophy stage. Increase in maximum tension generating capacity and displacement of length tension curve close to the longer immobilization position. So as I said in shortened thing, the length and tension relationship may reduce in shortened position, but in lengthened position it can exceed the normal situation. And passive tension in muscle approximates that of muscle before immobilization. Just because we are keeping a particular muscle, we are keeping this muscle in a normal length. There is not much more reduction in this normal tension which can be produced by that particular muscle, because we are not reducing that normal muscular structure. We are actually keeping that particular muscle in a normal state. Because of that, there is not much reduction in muscular tension. So now this is one of the main complications which can arise from this immobilization. First one is that the length will be reduced. The length of tissues which are surrounding that particular region may reduce if you keep in that shortened position, or if you keep it in lengthened position also, the normal physiology may alter. So how we can prevent this? So whenever we get a fracture case, or whenever we encounter with any immobilization case, we always try to minimize or to avoid this immobilization effect. So one of the main uh, thing which can be done to prevent or to reduce this immobilization effect is to provide a continuous range of motion exercise. So whenever we go to the patient, we ask the patient to do at least a 30 minutes of range of motion exercise within the pain range. So if the fracture happen, there will be pain. So we will be asking the patient to do some kind of range of motion exercise to maintain the normal length. At that stage, we are not aiming for any strength increasing, or we are not aiming for any endurance training. Our main aim is to maintain that normal muscular length by keeping some range of motion exercise. So that is one of the things which can be advised to the patient to avoid this immobilization effect, mainly this shortening of muscular structures or the structures which are surrounding a particular joint. So next one is injury. So whenever we have any recreational activities, so there can be a high chance of getting some injuries. So when we discuss about injury, there can be two situations: a normal type of injury and an overuse injury. So overuse injury just means that there will be a repeated use of that particular structure. So whenever there is a repeated injury, repeated use, then the muscle can go for some amount of fatigue. That means the muscle may not be able to hold that particular action for a long period of time, so it will go for fatigue. That fatigue can result in some kind of injury. So overuse may cause injury to tendons, ligaments, bursa, nerves, cartilage, and muscle. The common etiology of these injuries is repetitive trauma that does not allow time for complete repair of tissue. So the best example is that whenever we play football, so if you have some ankle sprain, so we may take rest for 1 or 2 days. So once the pain reduces, we might think that the injury healed. So again, we will be going for gain. So once we encounter with the gain, then there's a high chance of getting overuse injury, just because the previous injury is not healed. So whenever there is an injury, the injury may take weeks to heal to the normal physiological state. So whenever we go for repeated overuse, then that particular structure can go for a repeated injury. That is an unwanted situation. So muscles and tendon can fatigue with repetitive submaximal loading with rapidly applied loads, and when the active muscular tendinous unit is stretched by external forces. So the muscle and tendon can go for injuries by giving repeated muscular forces or repeated muscular loads. The best example is that when we go for gym, so we on the first day we will be doing some kind of exercise, but when we overload that particular muscle, or whenever we overload that muscle with excessive amount of weight, then it can give us some pain. So the pain is an indication for some injury which happened in our body, either by some traumas or some any kind of thing. So the pain is an indication for any trauma. So this is an example how the muscle injuries can happen. And tendon. So whenever we try for stretching, so to an extent the body or the structure may able to withhold that particular stretching force, but whenever we exceed that normal stretching region, or whenever we exceed the normal stretching pressure, then that muscular tendinous junction can go for some injuries. And next one is bursa. Burses can go for some inflammation, or repeated uh, traumas to the bursa can result in some kind of inflammation. And nerve can go for some compression injuries. So whenever we continuously overuse particular region, then the nerves which is present in that region can go for compression, either due to the inflammation which is caused by the soft tissues, or by some other factor. So these are the overuse injuries which can happen. Then is muscle strain. Muscle strain injuries can occur from a single high force contraction of the muscle while the muscle is in lengthened by external forces. The muscle usually fails at the junction between muscle and tendon. So the classical example for this muscle strain is so whenever we try for some overhead activities, whenever we try for throwing something in that lengthened position of that particular muscle, if we give excessive load, then we may experience some kind of shoulder pain. So it just because in that lengthened position, the maximum lengthened position of muscle, in that maximum lengthened position of that muscle, we are exerting some forces. So that can cause some muscle strain. So basically, this muscle injuries and muscle strains are happening in the junction between tendon and muscle. So next is eccentric exercise induced muscle injury. So when we discussed about type of muscle contraction, there are many types of contraction, that concentric, eccentric and isometric. So these concentric and isometrics are not a injury causing type of contraction, but when we discuss about eccentric muscular contraction, it can cause some muscular injuries. So injury to a muscle may occur as a result of of a, even a single bout of eccentric exercise. After 30 to 40 minutes of eccentric exercise, walking downhill, or as of you 10 to 15 to 20 repetitions of high load eccentric contraction, significant sustained reductions in maximum voluntary contractions can occur. So I hope that we all have encountered with such kind of situations. So whenever we go for some downhill running, or downhill walking, or an uphill walking, then after that particular activity we may not be able to go for further activities. Our body will be our body is not able to go for maximum force production. Another example is that whenever we have this exercise dumbbells, at the beginning we will be continuously working with that high weight of dumbbell, but after some repetitions we may not be able to complete that particular action, just because this eccentric actions can go for uh, it can cause some voluntary reduction in maximum voluntary contraction, because whenever this eccentric contraction is happening, there's a high chance of having some reductions in this normal maximum voluntary contraction. Next is DOMS. DOMS is something like the etiology of DOMS, this delayed onset of muscle soreness, is unknown, but it is hypothesized that whenever we try for some exercises, or if you are doing some exercise for continuous period of time, the tissues, the basic tissues, can go for fatigue, and there can be some microcellular injuries. But the clinical feature which is peculiar with this DOMS is that whenever we had some injuries, the DOMS will not appear immediately after that injury. So whenever there is this micromolecular injuries that happen, it will take about 24 to 48 hours to show some symptoms. So the best example is that whenever we in normal college festivals or in athletic meets, we will be running after a long period of time, or we may try to participate in some events. So whenever we try for that, on that day we may not be able to feel any kind of pain, or we may not be feeling any kind of abnormalities, but on the next day the pain will be excruciating, the pain will be increasing, and it will last for about 48 to 72 hours, and after that it will be reducing. So that's what is DOMS. The exact etiology or exact cause of this DOMS is still unknown, but it is hypothesized that there can be some cellular level injuries, and there can be some excessive amount of waste products which is produced by this muscle. All of this can cause some kind of pain or some kind of chemical reactions that might be causing DOMS. And next situation where we can have some abnormal muscular activities is the aging. So as we age, uh, whenever we observe any aged persons, the first thing which we can notice in them is that their normal muscle bulk or their normal body shape is lost. So the reason for that particular change in that body structure or the muscular size or muscular shape is because of this sarcopenia. So as you can see in this picture, in normal young adults, this is a thigh compartment. So we have this normal muscles, and the normal muscles is filled with normal muscle fibers. But as we ages, this normal fibers can adopt to some physiological changes. So one of the main changes is that this yellow is something which uh, denotes the fat which are present in that particular region. So in the young people, the number of fat cells is less compared to old age people. So as the body grows, the normal muscle fibers can be replaced by these fat cells. So if it is replaced by fat cells, and automatically our normal muscle shape will be lost, it will be filled with fat. So that's what called as sarcopenia. So as age uh, advances, there can be a high chance of replacing these muscular structures with some fatty or some other structures, other substances. So whenever that kind of changes are happening, we call it as a sarcopenic changes in old age. Next is connective tissues changes. So in normal adult human body, that means in normal young human body, the connective tissues are uh, accounted for 20% of total muscle structure. But as the body advances with age, what happens is that the amount of connective tissue in that particular muscles may increase. So as a result of that, the normal flexibility of muscle may be altered. So because we have our normal flexibility, and we are able to go for maximum movements, just because our muscle is able to go for maximum flexibility, because there is only maximum to 20 percentage of connective tissues are present in our muscle structure. But as the age increases, this 20 percentage may increase to up to 40 to 50 percentage. So whenever it exceeds this normal uh, muscle amount, then it can give some stiffness and other kind of uh, problems which can arrive from that, basically the reduction in flexibility. So that's the reason why the old age peoples may not be having that normal flexibility, and they are not able to go for maximum range of motion. They will be having this stiffness for a long period of time. This is the reason why they are having that particular stiffness in whole days. So that's about this whole chapter. So I hope that you all are able to follow me, and I hope that we will be having some discussions about all this once our college is reopened. So don't worry if you are not able to follow me now, and we'll have a discussion about it later.